What's up, YouTube? Welcome back to my channel. Today I'm bringing you a video. Well, obviously I'm bringing you a video, but I'm bringing you another video. I honestly, I was sitting, I don't know, I was thinking earlier and I was thinking to myself, why did I not make this video when I ended my first semester of nursing school? But anyways, better late than never. So as basically the title says, I am going to do my video today over my clinical experience of my first semester of nursing school. So let's just jump straight into the video. Okay, so just to basically explain, kind of have a little background information of how clinical works at my program, my nursing school. So how it works is, okay, so we have a cohort of people, whatever, we're all in the same class. However, we have different clinical days, and then so say within those clinical days, okay, let's just say my clinical day was on Friday. So let's just say there are 2 instructors, so that's 2 different classes, each with a clinical group. Within that clinical group, let's just say you'll have about 8 to 10 people. And then I guess depending on the hospital that you're at, or I guess really just depending on your instructor, you'll be split up as far as okay, I'm going to have this set amount of people on this floor and this set amount of people on, another floor, just so that way we're not all crowded on one floor. Something else, I have it written down over here, but something else, okay, so how it worked for us last semester, again, if you don't know, I'm in my second semester of nursing school. Well, I'm finishing up my second semester. Obviously last semester I was in my first semester. So how it worked last semester for us was, so for the first, I think it was 4 weeks, we were actually at the school. We didn't go to the hospital. We were at the school basically learning our skills. So everything that we needed to know. So catheter insertions, NG tubes, medications, how to properly administer medications, making beds, all the basic things that you need to be a nurse, you'll learn that in your first semester. So we did that for the first, like I said, 4 weeks, I think it was. And then from there, we went on to going to the hospital. So once we got to the hospital our first day, mind you, we were all super nervous. I mean, I know I was super nervous. But I think all of us as a whole, we were kind of okay, we didn't know what to expect. We just kind of felt like we were being thrown out there to an extent. However, our first day of clinical, we had to show up to the hospital. I think it was at 6:30, we had to be on the unit to make sure that we got report. And that is one of the mistakes that I know my group made. We had we weren't really even instructed on how to do it or what to do exactly. But of course we figured out in the long run. But so when you first arrive to the unit, you're supposed to find your nurse. Obviously your nurse is going to be the patient who you chose. Okay, little disclaimer here. I don't know if all programs do this, but I know for my specific school, we have to, so the day before clinical, you go out and you pick a patient. So with that patient, you actually work on a care plan. So I'll talk about care plans later. But anyways, okay, so let's just say you found out who your nurse is. So since you're coming in as a nurse, morning shift type nurse, you're supposed to listen on with the nurse that you're going to be with all day, as far as getting the report from the night nurse. I don't know if I said that right, but basically you're just listening for the report based on your patient from the night prior to. Okay, so care plans while I'm kind of close to that. So my school, our care plan for our first semester, I think it was 12 pages long, plus having to do medication sheets. And you had to do a little medication form. Well, not medication form, that's this semester. But you had to do a little, not even little, you have to put in so much information regarding one medication. I remember my first patient, and I had no idea that a care plan was going to take me so long. I didn't even know really what a care plan was, but I remember my first patient had 35 medications, and honestly and truly, this is no joke. The night before my first clinical, I was up till, I think it was 3:30, almost 4 o'clock in the morning. Had to get up at 5:30 to make it to clinical on time. So I will never ever forget that. My first care plan, it took me forever. Because honestly, I didn't know how to do it. And in the long run, I found out I wasn't the only one that had to stay up that late. So basically, I just want to tell you guys, if you're starting nursing school in the spring, make sure you get a good understanding of how your care plans, if you do have to do care plans, how they're supposed to be done correctly, and how to do them right, because if you do them right, that's obviously going to save you time. And if you don't know what a care plan is, basically it's just, how can I put this? So you'll have medications in a care plan. You'll have the patho tree. We call it a patho tree. So basically what the patient is admitted for, you'll have a patho tree of that with like the causes, the risk factors, the treatment, the diagnosis, all that. Also, the main important thing that I know instructors really look at is your nursing diagnosis. And basically what a nursing diagnosis is something that you formulate based off of the manifestations or the symptoms that the patient has. And then your interventions, or basically, okay, before you get to interventions, you want to have a goal. I feel like I need to make a whole video on this, because so with your nursing diagnosis, you want to have a goal that you want your patient to meet by the end of the shift, and what interventions, or basically what you're going to do as a nurse to make sure that goal is met by the end of shift. So again, like my first clinical, I was like, what? Like, where am I supposed to get this information from? Like, how does this work? I was lost. I was honestly done for. But okay, so moving forward, let me say this real quick. So when I first made my my very first YouTube video, I think I said something around the words of, I'm making this channel because I wish, like, things that I say are things that I wish I would have knew prior to starting nursing school. So I say that to say this: in your clinicals, whether it be your first, second, third, fourth, fifth, whatever semester clinical, and even when you actually become a nurse, you are going to come, I mean, there's no ands, ifs, or buts about it. I've encountered it. I've experienced it. It's life. You're going to come across nurses that don't want to help you. They're rude to you. They might not even acknowledge your presence. Things of that nature. And I say that to let you guys know, do not let that affect you. Do not let that discourage you. Do not let that put any type of negativity on you, on your brain. Don't think, is there something wrong with me? Because sometimes, and a lot of the times actually, there are those nurses that they may act like that, but they may not be doing it like intentionally. They may not be trying to do it. Sometimes, nurses get busy. The hospital that I was at last semester for my first semester, those nurses had 7 patients each. 7. That's a lot. So don't let that bother you so much. But if it gets to the point where you just have absolutely no one to teach you, you don't feel like you're benefiting, you don't feel like you're learning anything, you need to let your clinical instructor know, because your first semester of clinicals are for your basics. So if you don't get your basics down, once you get to second, third, fourth, and if you have a 5th semester, that can really hinder you. Like, if you don't know your basics, how are you going to get to the advanced parts? So make sure, you're getting the best clinical practice that you can. Something else I want to point out that we have, and we still have it in my second semester, or the second semester, not mine, but the second semester, and I know 3rd, 4th, and my 5th semester, we have something called a simulation lab. So really what a simulation lab does is it tests your knowledge. At first, I hated them, but I've grown to appreciate them to a sense. I actually just had a simulation lab. Again, I'm in 2nd semester, but I just had a simulation lab this past Tuesday. Today's Thursday. So yeah, this past Tuesday. And I've realized I've come a long way since my simulation in 1st semester. So what it is so each nursing school should have a lab where you have your fake patients, like your little patient, I don't know what they're called, but the little patient dummies in the bed. So during a simulation, what happens is your instructors or whoever is in charge of your lab will actually input certain information into the system, like a computer system, that will allow your patient to basically be real. So for example, the simulation lab we had on Tuesday was regarding a patient that had sickle cell. So basically we had to monitor vital signs, we had to do catheter insertions, we had to do blood transfusions. It tests to see, because okay, when you're in your actual clinical setting at the hospital, you're doing what your nurse is telling you to do. You don't really have that freedom to make decisions, to see, okay, if I'm put in this position, what am I going to do as a nurse? You know, at your clinical hospital setting, you're the student nurse, so you have to be directed as to what to do. But when you're in simulation, you make the decision. So if your patient dies, it's on you. And we do have, like, we've had a simulation lab where the patient has died. So if you want to administer any type of medications, you want to call the doctor and ask for specific orders. If you want to question the order, it will be on you. And so that's why I say, like, it tests you. If you don't know, okay, well, if this looks like this, if this patient has this type of lab value, should they be administered this medication? If their blood pressure is this, should I give them this medication? It tests you. So that way, and it's not even like, in the end, you'll get critique of what you did wrong, what you did right. And it's honestly a really good learning experience. At first, I am telling you, it is going to be so nerve-wracking because not only do you have your instructors in the room, and our instructors actually act like the patient. So they speak for the patient because, again, the patient is not real. So they speak as if they were the patient. So, again, you have your instructors in the room. You have your other peers in the room watching you, also critiquing you. So at first, it can be really nerve-wracking. And you'll have moments and times where you'll feel overwhelmed. You'll feel anxious. You'll feel nervous. Like, you may feel like you don't know what to do. But you don't do this by yourself. You do it as a group. It'll be you and like 3 or 4 other people. Each of you will have a different role. You'll have a charge nurse, a medication nurse, documentation nurse, and an assessment nurse. So, like I said, it's something that gets better with time. Honestly, where I'm at now, I'm still working on simulation. I'm still trying to get better. I'm still trying to build, confidence to be able to make decisions and make the right decisions. So, okay, moving forward. All right, so head to toe assessment. Well, my first semester, I was taking health assessment, so it kind of wasn't as bad for me. And I feel like the head to toe assessment is really a memorization type thing. So if you have good memory, you shouldn't have a problem with that. And honestly, if you take it literally from head to toe, you check everything, every system from head to toe, or not every system, but everything that needs to be checked from head to toe, it'll come to you easy. My first clinical, honestly, my first entire semester, I was like, I avoided the head to toe assessment so much. I was like, I don't want to do this. Like, first of all, you have to get, like, if you're not comfortable with touching patients, like if you've never really dealt with patients before, you want to break that barrier your first semester. So, I mean, that was really, when I first started doing head to toe assessments, that's the first time I actually had interaction with an actual patient in the hospital. So it was really a big adjustment for me. I wanted to make sure, like, I wasn't hurting the patient. Like, I could be just listening to the breath sounds and I'd automatically think, okay, am I doing this right? Like, am I in the right place? And that's to the point to where you have to just be confident. Like, keep in mind, you made it to nursing school for a reason. There are others who, would love to be in your spot. And just learn to stop questioning yourself. And I know I say this all the time. I feel like in every single video I'm saying, stop questioning yourself. Don't doubt yourself. Like, you're here for a reason. So, I mean, just do it to the best of your ability. And honestly, you're there to learn. So if you do it wrong, either your instructor is going to fix it or not fix it, but either your instructor is going to tell you so you know for the next time, or the nurse. Either or, again, it's a learning experience. You're not going to be perfect, because if you're perfect, you would already be, I can't even talk. But if, what am I even saying? If you were perfect, you'd already be licensed. You'd already, like, taken the NCLEX and all that. We know, or not we, but the instructors know you're not perfect. You're learning. Okay, and something else. So, you're going to have, basically you'll have one patient that you're kind of assigned to, or that you picked out. Don't just stick with that patient. In order for you to expand your knowledge, to see different things, to experience different things, you're going to have to not only, yes, your main care is on your patient, but you want to ask your nurse, okay, hey, like, you have like 6 other patients, you have 4 other patients. Is it okay if I just follow you around, maybe do some things for you, whatever the case may be? Don't just stick with your patient. You want to kind of get a taste of every patient that your nurse is taking care of, so that way you can experience different things. And that kind of also falls under asking the PCAs if they need help. There is nothing, absolutely nothing wrong with you learning how to make beds, learning how to give bed baths, just giving showers or baths in general to your patients. There's absolutely nothing wrong with that, because honestly, when you become a nurse, there may be times where you don't have a PCA and your patient needs their bed made, your patient needs this, your patient needs that, and you don't have that PCA. You're going to have to do it as a nurse. So you might as well master it now, help out now, because honestly, if you're just sitting around in clinical, if you're there for 8, 9, however many hours, and you're just sitting there, the time is going to go by so slow. So you want to make sure you're active, you're always doing something. Yeah, I mean, there were some times where I would sit down because I would actually work on my care plan. So because the only time obviously you can get the patient information is at the hospital. So other than that, if you're not sitting down working on your care plan, you should be up helping, getting that experience, and because obviously that's what you're there for. And then the last thing is, I mean, basically what I've been saying, just be confident. The more confident you display yourself to your patient, to your, whether, like I said, to your patient, whether it be to your instructor, to the nurse, to whomever, just in life in general, if you seem confident, that person is going to be more comfortable around you. So let's just say, speaking for a patient wise, if you go in the room and you're quiet, okay, so for example, when we go to pick a patient out the day before our clinical, we have to ask the patient, is it okay if, introduce yourself and ask them, is it okay if I'm your student nurse for the following day? So if you go in the room and you're like, hello, my name is, like, you're so quiet, if you're asking me, I'm going to say no, because you seem like, do you know what you're doing? Do I really want you helping with my care? If I'm sick, you're scared to, like, I wouldn't want that. So you go in the room, you just be confident. And again, this is something that comes with time. I'm not expecting, me personally, if I was an instructor, I wouldn't expect, everything to be perfect right off the bat, because it's not going to be perfect. You learn with time. So just go in with confidence. Repetition is key. If you have to do care plans, I promise you, you'll find a way to make it easier. Your first one is going to be something. But I mean, the care plans that I have to do this semester, they're not as tedious. It doesn't take me as long at all. It does take me a long time still, but definitely not as long as to staying up till 3, 4 o'clock in the morning to get it done. So I think that is it. Yeah. So I think that's it for my clinical experience for my first semester. I just want to honestly thank you guys for watching this video. Make sure you like, subscribe. If you have any other video topics you want me to discuss, please let me know. I know someone asked me about doing a video on my experience at main campus in PV. I will get to that. I'd have to make sure, not that I say the right things, but that I have enough to actually talk about, if that makes sense. I will get to that video, excuse me, as soon as possible. And again, any other videos you guys want me to do. So one more time, make sure you like this video, subscribe, and I will see you guys in the next video.
Yeah, you're looking at the truth, the money never lies.